Let's dive into endocarditis prophylaxis for your FNP boards, focusing on who truly needs it. The ACC AHA guidelines are crystal clear. Prophylaxis is recommended only for patients with high-risk cardiac conditions. This includes those with prosthetic cardiac valves, a previous history of infective endocarditis, unrepaired cyanotic congenital heart disease, and those who have had their congenital heart defects repaired with prosthetic material within 6 months. Also, consider cardiac transplant recipients who develop issues with their valves. But here's the twist. Mitral valve prolapse, bicuspid aortic valves, and acquired valve diseases don't require prophylaxis. When it comes to dental procedures that involve gingival manipulation or mucosal perforation, administer 2 grams of Amoxicillin 1 hour prior. Administer 2 grams of Amoxicillin 1 hour prior. If there's a penicillin allergy, switch to Clindamycin or Azithromycin. Remember, prophylaxis is not routinely indicated for GI or GU procedures. Keep dental in focus, so pass with purpose and stay sharp. Follow the NP Readiness Bootcamp for more daily insights.